Can COVID is an open science collective dedicated to rapidly mobilizing and sharing knowledge to help inform Canada's COVID-19 response. To learn more about us or how to join our community, you can visit our website at cancovid.ca.
Okay, so I think we're ready to get started. Hello, everyone, and welcome to this week's edition of Can COVID Speaker Series. Thank you for joining us today. My name is Rosa Staltieri, and I lead the research and evaluations team here at Can COVID. And I have the great pleasure to introducing you to this week's speakers. Doris, Zhang, who is a PhD candidate at the Department of Psychology at the University of Alberta, and Yekta, Sharafaddin-zadeh, who is also a Master's of Science candidate, also at the Department of Psychology at the University of Alberta. And our title for today is The Chinese-Canadian Experience During COVID and the Cultural Meanings and Practices Associated with Masks for Chinese/non-Chinese Canadians. So just a few items before we get started. We did save some time at the end of today's presentation for a Q&A session, so please don't be shy, enter in your questions at any point during the session, and just ensure that you do select to everyone when doing so. And as always, we have a brief announcement at the end of today's session. So without further ado, I'll hand over the floor to Yekta. Thanks.
Welcome, and a big thank you to Can COVID for providing this opportunity. During this seminar, we will be discussing two studies that investigate Canadians' perceptions of face masks and reactions to public health messaging early in the COVID-19 pandemic. Speaking from the traditional territories of the Indigenous peoples of the Treaty 6 region, I would like to acknowledge our interdisciplinary research team from the University of Alberta and Victoria for their contributions to these studies. Our team consists of a group of researchers and scholars from psychology, anthropology, and computer science. The first study looked at Canadians' perceptions of face masks on Twitter during the first wave of the COVID-19 pandemic. In response to containing the spread of the COVID-19 pandemic, many countries immediately began to emphasize the adherence to preventive measures such as frequent hand washing, social distancing, and sanitizing. However, unlike some countries in the East that had already begun recommending universal masking, public health officials in Canada did not recommend this practice as a preventive health behavior until early April during the first wave of the pandemic, which lasted from January to September 2020. With these shifts came several controversial discussions about the use of face masks, particularly who should wear them, when, and why, on Twitter. Furthermore, the scope and nature of these discussions continue to evolve alongside the several events that shape the climate of the ever-evolving pandemic. For instance, many took their opinions to Twitter to comment about mask shortages, the confusion about masking recommendations, and mixed public health messaging, among other topics. For instance, this slide shows Michelle Rampol, a Conservative MP, share their sense of mistrust in public health officials as a result of the inconsistent messaging. They tweeted, "Okay, I'm going to say it because someone has to say it. Flip-flops and travel restrictions, border closures, etc. And now this. At what point is it acceptable to question the adequacy of the advice our leaders are acting on? Exhibit A and Exhibit B on masks." She then embedded two screenshots in her tweet to display the shift in masking recommendations. The first, Exhibit A, displayed a screenshot from a news report made in late March, which concluded that Dr. Tam maintained that masks do little for healthy individuals. The second, Exhibit B, displayed a screenshot from CTV News, quoting Dr. Tam's new recommendations that wearing a mask outside is a good idea. Inevitably, these issues continued to evolve. When cases started to rise in Canada, issue of mask shortages intensified. Restrictions set to protect the health of Canadians brought changes to our day-to-day lives, which appeared as a contrast to our demographic and egalitarian government. As such, lockdowns, quarantines, and mask mandates fueled several anti-mask and lockdown protests. Because Twitter provides a breeding ground for the emergence, development, and exchange of perceptions and attitudes, it allows researchers to draw insight on public discourse during a global health crisis. We collected millions of tweets using a machine learning approach to understand the public discourse on face masks and psychological reactions to mask wearing during the first wave of the COVID-19 pandemic. Specifically, we were interested to identify key themes and how they might change throughout the first wave in tandem with the events that occurred around that time. So why should we do this study and what benefits could it serve? Considering that early intervention can play an important role in the outcomes of a health crisis, investigating the scope and changes in public attitudes and beliefs relative to initial public health guidelines and restrictions is vital for future preparedness plans and procedures. In addition to traditional social science methodologies like questionnaires, surveys, and focus groups, social media also gives us another tool to understand people's extemporaneous opinions and attitudes towards face masks and mask wearing. Using computer science techniques of data mining and machine learning, we use an existing Twitter dataset collecting public tweets containing COVID-related keywords from January 21st, 2020 to present date. Because the COVID-19 Twitter dataset is unlabeled, we filtered the data for English language tweets. We then limited the corpus of our data to a specific geographic region by training a classifier that identified and extracted likely Canadian tweets using Canadian identifiers like users' geotag location, description, etc. We also conducted topic modeling analyses and extracted more general key topics dominating Twitter discourse that aligned with the in-depth qualitative analysis. We then investigated the data from the first wave using an inductive data-driven grounded theory approach. This figure displays the frequency of daily posts containing the case-insensitive token mask in yellow, superimposed onto the frequency of daily COVID-19 cases in Canada in blue. If we consider the events that were going on around this time, we know that the public health messaging about masks shifted in early April. And we know that there was a rise of cases, mask mandates, and stay-at-home orders around May. It is likely that internet discussions about these events precipitated shortly after their occurrence. Thus, we see that much of the conversation around face masks and mask wearing on Twitter occurred near the end of the first wave. This figure shows several distributions of daily tweets with each color representing a type of mask. The red line represents N95 masks, the green line represents surgical masks, the blue line represents cloth masks, and yellow line represents the distribution of non-medical masks. We see that N95s and surgical masks dominated much of the conversation occurring early on. This changes drastically when the yellow and blue lines start to pick up around mid-May. This change suggests a shift in the discourse around face masks and mask wearing, likely signaling the rise in recommendations for cloth and non-medical masks and reserving N95s and surgical masks for healthcare workers. While analyzing the textual data, it became clear that several distinct but conceptually related themes contributed to Canadians' attitudes and perceptions of mask wearing. In discussing anti-masking sentiment, 5 major themes emerge. Face mask efficacy reflects users' beliefs about mask wearing as a preventive behavior. The following tweet reflects a negative attitude toward the efficacy of face masks. For instance, one user tweeted, "I have spoken to a number of healthcare professionals, all vastly experienced, and they all agree that wearing a mask to protect yourself from the coronavirus is a complete waste of time. Regular hand washing, avoiding touching your nose/mouth, and avoiding sniffers will do." Personal discomfort reflects users' beliefs about mask wearing being uncomfortable, either for physical reasons or emotional reasons, such as feeling that wearing a mask is humiliating or silly. For instance, one user tweeted, "I'm not wearing a mask, it's ridiculous. I'm putting the bylaw out there for Calgarians." Perceived risk reflects users' beliefs about mask wearing as a measure that can affect your risk of contracting COVID. This category also included those that downplayed the severity of COVID-19 and believed wearing a mask was an extreme measure. For instance, one user tweeted, "No, because this virus is not airborne. In fact, you run a greater risk of contracting this virus by constantly bringing your hands to your face to adjust your mask. Coronavirus spreads by contact." Rights and freedoms reflects users' beliefs that mask wearing should be a choice, and restrictions and mandates implemented to enforce this behavior impacts a person's freedom. For instance, one user tweeted, "Perfectly said as I said from the start. You want to wear a mask? Go ahead. I think you're silly and nonsense to wear a face mask if you're not sick, but it's your choice to wear it, just like it's my choice not to wear it if I don't want to wear it." Culture clash reflects users' beliefs about mask wearing as an uncommon practice that is not part of Western culture. For instance, one user tweeted, "I feel strange to walk on the street wearing a procedure mask in the US. Passerby sometimes stare at you and express a puzzled face. But it is crucial for us to adopt this culture in the epidemic outbreak. It is a manner of protecting the community. Get used to it." Interestingly, over time, the frequency of tweets depicting such attitudes increased in frequency. Anti-masking sentiment is likely a multifaceted rationale, such that these aforementioned factors concurrently bolster each other, as well as other potential factors that did not emerge out of our thematic analysis. This is because many of the tweets often encapsulated a tangle of rationales where more than one of these distinct but related concepts were discussed simultaneously and in relation to each other. For instance, the following tweet shows an individual touching on face mask efficacy, highlighted in green, and rights and freedoms, highlighted in yellow. They state, "Corona will get past a face cloth covering. That's a fact. But if you want to wear a symbol to make yourself feel like you're protecting anyone or yourself, help yourself to mask happiness. You're free to do as you wish, just like the rest of us." This example shows us that people often think and talk about these five concurrently. I want to briefly mention the role some users played by acting as the middle persons in these discussions. For instance, the aforementioned tweet by Michelle Rampel demonstrates a polarized view of the public health messages. In response to these messages, some users will highlight opposing views to synthesize the polarized ends of the topic at hand. For instance, one user replied to her saying, "There is no gold standard of information or policy for the pandemic. Experts are learning as they go. Good science includes keeping an open mind and adapting new information." And on that note, I will turn the floor over to Doris.
Thank you, Yekta. So in reference to what Yekta has presented, the study I am presenting focuses more specifically from April to May 2020, when there were much ambiguity and confusion in Canada regarding public mask wearing. Acknowledging the pivotal role public health messaging plays in the provision of directives, we aim to identify the information needs of Canadians early in the pandemic to understand how future messaging could be improved to increase its public impact and effectiveness. Specifically, we conducted focus group interviews to learn about Canadians' common perspectives and concerns. 47 Canadians from various provinces were recruited on social media platforms to participate in the interviews. 9 focus group interviews were conducted on Zoom from April to May 2020 before reaching the point of saturation where no new themes emerged from the discussions. Each interview varied in terms of age, country of birth, length and province of residence, and previous use of masks. We encourage the participants to freely respond to the following questions, which ask them, what have you been using to protect yourselves against COVID-19? How did you learn about using, caring for, disposing of a face mask? What advice would you give to health authorities to improve public health messaging around masks? Interviews were recorded upon consent and transcribed to text in vivo for thematic analysis. We used an open coding approach in order to thoroughly explore common patterns of responses. So as a result, 4 meta themes emerged from the interviews. The first meta theme concerns information sources and credibility. The number in brackets represents the total number of participants that have talked about each theme during the interview. The participants reported using various sources to seek public health information, and that they relied more on the recommendations delivered by health professionals than non-health personnel. For instance, one participant said, "I'm relying on our chief medical officer for those kinds of recommendations." The participants also spoke, the second meta theme concerns inconsistencies and mistrust. So the participants also spoke about the inconsistency, ambiguity, and mixed messages with regards to health authorities' recommendations on mask use. The inconsistencies and contradictions in public health recommendations not only frustrated the participants, it also created public skepticism and mistrust toward health authorities. For instance, one participant shared with us that I think by switching the message around, it just fosters mistrust. The third meta theme concerns the need for more scientific information on three aspects, with the first being the proper use of masks. So the participants said that it was not enough to simply stress the need for more mask wearing. More attention should be given on disseminating knowledge on how to wear, clean, store, and dispose masks safely and properly. A lack of knowledge on the proper handling of masks could impede its use for some Canadians. For example, one participant said, I think now that they've come around to recommending the use of masks, they could perhaps improve messaging on proper use because I've seen people just pulling masks on and off as they're talking. Another participant told the group that the other reason I'm not using masks is I don't know how to dispose them afterwards. The second aspect concerns a lack of scientific evidence supporting the efficacy of cloth and homemade facial coverings. With a rise in public health recommendations on the use of cloth masks, the participants wanted more scientific evidence demonstrating its efficacy in preventing the spread of COVID-19. For instance, one participant said, they've tested medical face masks and respirators, so there is science and there is data on that. But the data on wearing something homemade, it's not conclusive. Also, when different types of masks were recommended for use, the participants wanted more scientific information that helps them in choosing the most effective type of masks to wear in different settings, such as when they're on an airplane, in the grocery store, or also in the car. The third aspect concerns a need for scientific evidence that supports public mask use. The participants said that more information should be provided to the general public about the science behind public mask wearing and its impact on containing the spread of COVID-19, which might be especially helpful to people who are doubtful of this preventative practice. This is reflected in the quote that reads, there just needs to be more education about the benefits of a face mask. Another participant said, I saw a video done by these Japanese scientists. It really opened my eyes as to why people would wear a mask. If everyone saw that video, I thought there would be this huge change in how people think. This quote illuminates the helpfulness of creating educational videos to show the public the process of how masks work against respiratory viruses to help individuals in making more informed preventative decisions. The final meta theme concerns Canadians' guilt and shame in using medical grade masks early in the pandemic. Our participants expressed their concerns regarding a shortage in personal protective equipment for frontline medical workers near the start of the pandemic, and they felt guilty for owning and using medical masks, knowing that medical workers were in a greater need of them. This is reflected in the participants' responses, such as, I feel bad using an N95 respirator. What are people going to think? I stole these from medical professionals? And I feel bad. Maybe I should donate the N95 respirators. Due to their support and concerns for the safety of medical workers, a theme of N95 shaming surfaced from the discussions, where the participants talked about how wearing medical masks may subject oneself to public judgment, so that wearing medical PPE almost became a stigma in the beginning. For instance, one participant said, if I saw someone wearing an N95, maybe I'd be like, hey, why you got that? Where did you get it from? Why didn't you give it to your nurse friend? On a related note, another participant said, I saw a video of someone shaming people wearing masks. So in sum, our interviews found the following. First, the participants were actively following public health messaging regarding the COVID-19 pandemic and how to achieve protection. Despite having a high regard for health authorities, the rapid shifts and inconsistencies in messaging eroded their trust in health professionals. Aside from recommending mass masking, the Canadians we interviewed wanted more scientific evidence to support the benefits of mask use. And with the various types of masks available, they hoped to receive more guidance on choosing the appropriate type of masks to wear in different contexts and how to handle masks properly according to prescribed medical standards. We also noticed that the participants stood in solidarity with healthcare workers, such that they were willing to compromise their own well-being to secure the safety and the needs of the medical workers during PPE shortage. So based on the two studies we presented, we offered the following recommendations for future public health messaging. First, for broad-reaching effects and stronger impact, public health recommendations should be delivered to the public via multiple channels and sources and by reputable medical health professionals. These professionals could also play a role in influencing social media discourse. As such, it's important for them and other verified users to actively try to balance polarized views on the internet to foster a culture of open-mindedness online. Second, in cases that a drastic change in recommendation is required, this change should be supported by the best scientific evidence available to inform the public on why such change is necessary. Doing so may help to increase information transparency and maintains public trust in times of uncertainty. Third, when introducing a new PPE, public health messaging should clearly explain the benefits of use and the imperativeness of proper use, because improper use could have serious consequences on one's health. Both personal and public health consequences due to non-compliance should be clearly communicated to the public in order to assist people in making more informed decisions in a public health crisis. And this takes us to the end of the session. More information about the public health messaging study can be found in our article that was published earlier this year. If you would like to learn more about other COVID-19 research that our team has conducted, please visit our COVID-19 Health and Interethnic Relations website. Thank you, and we will now open the floor to questions.
Thank you so much, Doris and Yekta. What a fantastic presentation and interesting work as well. So we'll get started. We have about 7 minutes for Q&A. So we'll start with the first question here. Curious to know how you, and I think this is a question for Yekta, curious to know how you distinguish non-medical masks from cloth masks. We've typically identified cloth masks as a type of non-medical mask. And I think the question's referring to the Twitter traffic figure.
Right. Thank you for your question. So on the chart, essentially, I only created that based off of the case insensitive token cloth and non-medical with a dash and without a dash. So essentially they are, when we discuss it in the study, they are essentially the same thing. It's more so what word was used in the tweets. So non-medical masks was just more popular, but essentially they are more or less the same kind of thing. Does that answer the question?
Sounds like it. And if not, we'll have me to type into the chat box. So our next question is for Doris. I understand that there were 30 females and 17 males in your study. Did you notice any gender differences in your findings?
So in regards to the public, in regards to their perspectives and opinions on public health recommendations, there were no gender differences that we noted from the themes, but because the interviews were a part of a bigger study, so we did find some interesting gender differences when the participants responded about, personal discomfort of wearing a mask.
Perfect. So The next one here is, can you comment on demographic patterns and trends as it relates to mask wearing? So this is another question for Doris. How might you target public health messaging for youth versus older aged, urban versus rural, for example?
That is a very good question. So I think different age groups may have different needs in terms of what information they would like to see. And then they may very well use different sources. So there may be different ways of influencing the public health practices of these different age groups. So for instance, with the recommendation given by one of the participants we interviewed about, this really cool animated video showing how masks work, that was mentioned by one of the participant who was quite young, compared to some of the older participants. So in reference to that, it may be helpful for the younger generation, to see these animated videos that convey scientific information, with those professional jargons transformed into lay people words, and then spread the information out this way. Whereas some of the older participants we interviewed, they tend to rely more on articles, news sources, or these interviews by medical professionals. They tend to rely on the information from these sources compared to those more creative sources, I guess, like those animated videos or posters like that.
Very interesting. So the next one question here is, and I'll leave this to both Doris and Yekta. So do you think if public health experts acknowledged in a better way why the messaging changed? So for example, due to our changing understanding of the pandemic, if this would have helped to decrease the amount of resistance on mask wearing? So whoever wants to start.
Yeah, I definitely think that public health messaging is meant to change as we learn more about a situation that is evolving and was relatively foreign to us compared to what we have encountered. So in our paper and in our research, we are not arguing against the change. Change should happen, right? As we learn more, as we acquire more knowledge. It's just that every time the change happens, we believe that a better way for the public to accept the change or to understand why there is a sudden change, especially, if a recommendation switches completely the other way around. Like in the beginning, there were recommendations saying that if you're not sick, there's no need to wear a mask, to, it's helpful if everybody wears a mask when you're outside, like when you're in a crowded space. So when changes as rapid as that happens, we believe that it's important for them to provide knowledge to the public in terms of, why we're suddenly recommending this change. And here is the scientific evidence that we're drawing this change from. And here are the benefits of this change. Instead of just saying, don't wear masks or wear masks now, the public needs to know why in order to be convinced.
And I would also just like to add that, especially based on the discussions online, it's very clear that a lot of us and a lot of people actually respect and appreciate transparency from public health figures. And I think there might be a sense of thinking that providing more reasons as to why messages are changing might create confusion or something like that. But I feel that more or less people will often understand, especially when we are very transparent with them.
Absolutely. And we just have about a minute here, so we'll try to get through some more questions. So Doris, interesting work. Could you clarify what the social media theme included? For example, could it include health experts and organizations' social media accounts sharing information via social media, or non-experts sharing content? For example, posts, others, celebrities, and the general public.
So just to clarify, is this question asking about the first theme, like the sources that the participants have used in order to receive public health information? Is that what the question is referring to? Sorry, just to clarify.
I think so. We can skip that one and have Sarah Wall to just clarify, and we can go back to it. Unless you have some comments, Doris, on that. We'll go to the next question. How's that?
Yeah, I would appreciate it. Thank you. I appreciate the clarification.
Yeah, no problem. Any comment on the role of peer pressure? I note your participants were 20 to 64 years old. Did they mention social dynamics and peer pressure?
So not in the scope of this study regarding public health messaging, but like I said, in the general interview where we included a lot of other questions about masks, the participants certainly expressed that in the beginning, even though for some of them who knew or who wanted to wear masks and who did wear masks, but when they saw that they were the only few wearing masks in their community, they did feel strange or tense or even a sense of embarrassment. So I'm not sure if that could be attributed to this peer pressure of wearing or not wearing masks, but certainly the environment and then how normative mask wearing becomes, it did seem to impact the personal comfort or discomfort our participants felt when they wore masks outside.
Okay, great. And we did have clarification from Sarah Wall. She says, yes, the sources. So would you like me to restate the question, Doris?
Yes, briefly, please. I would appreciate that.
Could you clarify what the social media theme included?
Okay, so basically for that question, we just asked the participants, where have you been obtaining information about the pandemic, about COVID-19, and about personal protection? And then the participants, they responded that they used social media sites such as, Facebook, Twitter, TikTok, and then on Twitter, especially, I believe that they did follow public health officials, either the provincial ones or the federal health authorities. So yeah, so I'm not sure if that answers your questions. And then I think some of them also did mention that they were following TikTok videos from health professionals, such as doctors and nurses, especially for those nurses and doctors who were demonstrating how to wear, how to store, how to clean, and how to throw away a mask safely. They were following videos as such.
Great. Well, it is 2 minutes past 4:30, so we're going to have to end the session here. I do want to take the opportunity on behalf of the Can COVID team. I'd like to extend our sincere thanks to you, Doris and Yekta, for sharing with us such important research. And I just wanted to congratulate you both because I thought it was an amazing presentation and interesting work. So thank you. Just a few announcements. Please join us for our next week's speaker series on Tuesday from 4 to 4:30 Eastern Time, where we will hear from Dr. Pablo Navarro from Memorial University. And this presentation will be around the decision support for COVID-related health systems inquiries. And this concludes today's event. Thank you again for joining us, and we'll see you all at the next event. Thank you very much.
Thank you.
Thank you.
We would like to thank our speakers and members of our network for their continued support and participation in Canada's pandemic response. If you are interested in learning more about Can COVID or joining our Pan-Canadian COVID-19 Research Network, please visit our website at www.cancovid.ca.